Hi, everyone. Welcome to the AEM Social EM Grassroots. And today we've been joined by Dr. Semelrath. And during this discussion, we're going to talk more about the Whitman-Walker Health System. Hello, Dr. Semelrath. Thank you for joining us today.
Hi, Lorado. It's my pleasure to be here. Thanks for having me.
Awesome. All right. So, can you please tell us a little bit about yourself as well as your relation with the Whitman-Walker Health System?
Sure. So I've been with the University of Maryland since 2019. I joined the faculty there after I separated from the Air Force. I was in the Air Force for about 14 years. So I've been faculty there. I work primarily at the Baltimore VA. And then in my kind of separate life, so I have been part of the board of directors on the Whitman-Walker Health Clinic since about that same time. I started the kind of interview process in fall of 2019 and then officially joined the board in January of 2020. So I sit on the board of directors of the Whitman-Walker Health Clinic, which is part of the overall health system.
All right, great. So, what is the Whitman-Walker Health System and what does it do?
Sure. So the Whitman-Walker Health has evolved and changed its organization. We actually just celebrated our 50th year in existence. So Whitman-Walker Health actually started as the gay men's clinic in the very early stages of the AIDS pandemic back in the 80s. So it was initially very focused on the folks within the greater DC area, the DMV area, of really the primary focus was gay men who were the first kind of patients in the AIDS epidemic and trying to provide them kind of whole health care at a time and place where it was very challenging for people within the queer community to get healthcare related specifically to HIV and AIDS. There was a lot of stigma involved. There was a lot of fear on healthcare workers' side of things, as well as, frankly, some blatant discrimination against gay men, and particularly gay men who were living with HIV at the time. And so it really started as a bastion of healthcare and compassionate care for those people. And then it's evolved over time to really become a kind of powerhouse of care still for everyone within the LGBTQ plus community. The Whitman-Walker Clinic right now is one of the largest providers of gender affirming care within DC for patients who are trans and who are seeking gender affirming care. It still maintains a large sexual health clinic for all members of the not only the queer community, but really anyone within the community. We have several sites within the city. We just opened a new, very large outpatient healthcare center. The new Max Robinson Center is in Anacostia in Ward 8 in DC, which is historically a medically underserved area of the city. So we're really excited about the evolution that Whitman-Walker has undergone over the past 50 years.
Nice. And I was just going through your website and some of the different things in addition to healthcare that they provide. Can you please tell us a little bit more about these
Oh,
services?
absolutely, yeah. So Whitman-Walker, our motto and our vision is the statement, "We see you." So we want to take our patients and our clients really through all aspects of their care. So obviously, medical care is a really large component of it, but we also provide a pretty extensive behavioral health services as well as dental services. We actually have a full suite of dental providers, both at our Northwest location and the new Max Robinson Center. We serve pediatric population for primary care, for gender affirming care. And then another really big aspect of it is our legal services and our benefits navigation system. So there are a full-time dedicated staff for benefit navigation. So folks who are low income or in poverty, we have folks who can help them manage the sometimes very frustrating bureaucracy of trying to apply for public benefits, things like Medicaid, food services, housing services. And then there is a whole legal team that can help with all sorts of legal needs for our population. One of the big things is helping our trans patients who need things like document name changes, driver's licenses, birth certificates, that type of stuff. How do you get all that organized for a reasonable cost that would is definitely more than most people can manage on their own. That's a big aspect of it. We do a lot of immigration work with the legal team, helping folks who may be undocumented kind of work through the process of naturalization. So it's a multimodal aspect of caring for a vulnerable population.
Yeah, yeah. It's really touching on very important aspect of our community. And I think also in areas that a lot of people struggle with, a lot of people need help with. And I think it's really great. What were some of the steps that were taken in order to both initiate it and also get all of these different components of healthcare as well as social aspects into place?
It's been really a kind of evolution as the organization has grown. Obviously, when Whitman-Walker first began, it was pretty much only focused on medical care. And we do it really well. We have just absolutely world-class providers and just really compassionate folks providing medical care. Obviously, as you and I know, our patients' medical care and their kind of state of health and state of well-being depends on a lot more than just medicine. And so that came into focus as we were going through the AIDS crisis and realized, hey, our patients really need a lot more help. They need help from lawyers. They need help from people like benefit managers, from mental health providers, from dental providers. And so as we grew in an organization and we realized these were what our patients actually need to be healthy as a whole person, then the organization started to grow and started to bring in all of those extra providers and extra services.
And what have been the outcomes so far?
So our outcomes are actually really fantastic. So our patients overwhelmingly really love and enjoy the care that they get at Whitman Walker. We have really high levels of patient satisfaction, particularly among our trans patients or patients who are seeking gender affirming care. With the expansion and the building of the new Max Robinson Center, we're now able to serve, I think we're on par to serve like 12,000 new patients this year, which is just incredible. In addition, we still have our site in on 14th Street in Northwest, and total, I think we're in the realm of 15,000 patients. We've had tremendous success in getting a lot of folks applied for and successfully gotten things like Medicaid and Medicare, as well as housing services. We've actually really had a great amount of success within our community. And we don't serve only LGBTQ plus people. We have families that seek care there. A lot of times it starts out as kids who are within the queer community seeking out a place that they feel comfortable with. And then their parents seeing the impact of the care and be like, oh, yeah, I want to get my care here too. And so we have families that kind of get all care together.
And I think one question that other people might have too is funding.
Mhm.
How is the organization able to acquire funding?
So Whitman-Walker Health is a federally qualified health system. So if FQHC or health center, I should say. So I forget the exact term. I think it's a 503B or 503C federally organized healthcare system. And so we do get a lot of federal funding. We have a absolutely wonderful director of operations, Megan Davies, who works tirelessly and relentlessly on grants. She has gotten multi-million dollar grant funding for the organization just within the past year. So we do that. Obviously, we have primary revenue from patient care. And so it can be challenging at times for sure, trying to prove our continued worth to the city government to get funding from them, to federal government get funding from them. Obviously all of that comes with a lot of added bureaucracy and paperwork and all that stuff. We try and seek out the funding as much as possible from all different sources. Fundraising is a huge part of it. So part of the broader Whitman-Walker Health System is something called the Whitman-Walker Foundation, which is our primary fundraising arm. So Abby Fenton is the director there, and she does a wonderful job. There's a number of different events organized throughout the year for kind of fundraising purposes. We try and get funding from essentially whatever sources we can in order to try and make sure that our patients are still able to access the care without it being a big financial burden on them.
Okay, great. And if any, are there any obstacles that you've experienced throughout, both with starting new projects or getting already existing work into completion?
As a member of the board of directors, I sit in the more kind of strategic role. I don't personally get involved in some of the projects that would be a conflict of interest on my part. Really, from that view, the strategic view, funding is always a source of concern whenever we want to try and start new things. The building of the new Max Robinson Center, obviously, it was desperately needed. The previous Max Robinson Center had a total of, I think, 4 exam rooms, and now we have 4 floors of examination space. But that's obviously a big kind of capital expenditure. And so, from our perspective, it's always funding is what we're looking at in terms of the biggest obstacle. And then part of it is still the stigma involved with the queer community. We try very hard to make sure that we are welcoming to everyone that comes through our doors. There is still some kind of stigma of this is still just for gay men. And we're trying to push it out. Nope, we serve everyone primarily within the queer community. But if you're an ally or if you just need a good place for compassionate care, we are welcome to you.
Awesome. All right. And for individuals that would like to get involved specifically with the Whitman-Walker Health System, what advice would you give them in going about doing so?
Yeah, absolutely. It's the good thing is it sounds like we're a big system, but we've got a lot of really good people for the front lines. For folks who are in the medical fields, there are ways and opportunities to get involved as volunteer medical providers, or if you're looking for a job, we obviously expanded a lot. There are opportunities for volunteering with our like sexual health clinic that operates typically in the evening times. There is obviously always a way to get involved as fundraising and donating. If you want to work some of the events, that's through the Whitman-Walker Foundation. For anyone listening who is interested in kind of research and policy, one of the other parts of the Whitman-Walker Health System is called the Whitman-Walker Institute. That's run by Dr. Kellen Baker, and that is our primary research and policy arm. They've got a ton of NIH and other funding stream granted research going on. They have really tireless kind of policy work trying to influence and mitigate some of the bad policy choices that our politicians are currently making, and always looking for kind of collaborators, especially if you're in a kind of bigger research oriented institution like University of Maryland, always looking for partners and collaborations. And it's very easy to get involved. If anyone is listening and wants more direction, I'm certainly available to help point you in the right direction to the folks we have. But really, everyone in the organization is really welcoming. And if you just approach and be like, hey, I want to help, what can I do? We can sit down and talk with you and figure out which aspect of the system would best meet mutual goals.
Awesome. And are you currently partnered with any community organizations or collaborating with them in any way?
Yeah, we're actually part of a group of similar FQHCs within this region, like Chase Brexton in Baltimore, Mary Center, Unity. I forget the exact name, but it's a collaboration between similar sized FQHC centers in trying to maximize the potential for all of the organizations and leverage when we have a bigger pool of folks coming together, leverage things to get access to greater opportunities and resources. So it's always been part of in recognizing that we obviously don't exist alone in this community. A lot of folks, it may not be necessarily convenient for them in our location. So we want to try and make sure people are getting the resources where they need. And that's where we've really partnered with a lot of the other local health centers.
Okay, great. What has been the response so far with the community and the patients you serve?
Yeah, it's been really overwhelmingly positive. We have every month when we have our board meeting, we get to hear one or oftentimes more impact statements from some of our current patients and clients if they use kind of legal services. And it's really very heartwarming just to hear the stories of folks who never thought that they would belong within a medical home, folks who never thought that they would be able to do what they have been able to do with the help of the resources that Whitman-Walker provides. And it's really just very refreshing just to hear how many people really consider Whitman-Walker part of their home and part of their lives. It's not just the place they go for their doctor's visit once a year. It's part of the community that we're in and part of the patients' lives that we serve. And it's been really very heartwarming to hear all that.
That's amazing. Yeah. And for individuals in other cities, even in Maryland as well, who want to start a similar initiative within the patient population, what advice would you give them?
It's a big task. I think there are now a growing number of organizations really across the country focusing on LGBTQ health. Particularly because there has been such a stigma and there has been such kind of distrust within our community towards healthcare for kind of, reasons stemming a lot from the AIDS crisis. So I think it's probably easier if you're in a larger metropolitan area. NYU and several of the other folks in Manhattan and New York City, they do a ton of work within the queer community. Health UCSF is another one of the big centers, Fenway Health up in Boston. So I think it's sometimes it takes a little bit of searching to find those organizations. They're definitely out there. Anyone in the DMV area, Whitman-Walker is a great place to start if you've got an idea and maybe you want to take it to other places that are underserved. But I think as long as you've got the idea and we can assist with maybe where to look for resources, it's always going to be a good thing to have welcoming, compassionate care for the queer community wherever you are.
Yep, that is true. That is true. All right, well, thank you so much, Dr. Semelrath, for taking the time to speak with us today. And speaking personally for me, someone who learns from you daily through patient care, through our DEI committee, it's always an honor to have you and always learn from you. And for our audience today, I hope you learned something from what we had, and I hope you were motivated enough to hopefully start something or share this idea with someone that you think might be interested. With that being said, thank you so much for joining us, Dr. Semelrath.
Thanks, Colorado. It was a great time.
Awesome. All right, I hope you all will be able to join us again next month for our next episode.